This video is a very important video for those who are going to be parents, first time pregnant women's and existing parents who are planning for a baby and having risk factors for the DDH, developmental dysplasia of the hips, or DDH. Yes, we as medical professionals required to do the hip test in all newborn babies, as a screening test. But if the examination of the hip joints are uncertain, then we refer the baby for the ultrasound scan of the hip. My name is Dr. Siha and I am specialist doctor. Before go further, please subscribe my channel and share with others. Let's discuss further how common is developmental dysplasia of the hips, or DDH, and how greatly does it impact those affected by it. Pondering this might lead us down a rabbit hole of intriguing medical conversations, so buckle up as we dive into the world of DDH. Developmental dysplasia of the hips, often abbreviated as DDH, is a condition that arises at or shortly after birth. And the word dysplasia is of Greek origin, dys meaning bad or difficult, and plasein meaning to form. Thus, it is a condition where the hips are not properly in joint or not shaped perfectly. Just to be aware that the DDH should be taken very seriously, which can cause the permanent damage to the hip joint if neglected. In a normal hip joint, the top of the thigh bone or femur fits snugly into the hip socket. In a child with DDH, however, this hip socket may not fully cover the ball portion of the upper thigh bone. This can cause the hip joint to become dislocated or unstable. Now, one might wonder what causes this condition. The exact cause of DDH remains unknown. However, several risk factors have been identified. These may include a family history of the condition. Yes, very important cause for sure. Being the firstborn child, a breech birth position, and being female. Yes, it seems that girls are more prone to DDH than boys. Symptoms of this condition can vary depending on the age of the child. In infants, it may be difficult to spread the affected hip or thigh apart. As the child begins to move about, a limp may become evident, or one leg might appear shorter than the other. When it comes to treating DDH, early diagnosis is key. The earlier it's detected, the simpler the treatment, which could be as straightforward as wearing a soft brace for a few months. This brace helps hold the ball portion of the joint firmly in its socket for proper development. In more severe cases, surgery might be required to position the hip joint correctly. To summarize, developmental dysplasia of the hips is a condition where the hip socket does not fully cover the upper thigh bone, causing the hip joint to become dislocated or unstable. Its exact cause remains unknown, but risk factors include a family history of DDH, being the firstborn, a breech birth position, and being female. Symptoms can vary, and early diagnosis is crucial for simpler treatment options. And so while the prevalence of DDH might not be widely discussed, understanding its impact, symptoms and treatments can equip us with the knowledge to identify and address this condition. Knowledge, after all, is the first step towards empowerment. I hope this video went very helpful, and one should be able to discuss with doctor regarding DDH if there is risk factor exist. Thanks for watching. Please follow my more upcoming videos.